Did you know hospice can look different depending on your condition? People's end of life journey can look different depending on what their diagnosis is and what they will likely die from. They can still be on hospice, but their journeys may look different. Meaning, if you went on to hospice due to some kind of cancer, it's going to look different than if you go on to hospice due to some kind of chronic terminal illness like dementia or Parkinson's or ALS. In this video, I want to talk about the two different journeys on hospice, how they look, and how hospice can help. So just speaking generally, when coming onto hospice, there's usually two types of patients. Again, this is general. There are many different versions of how your end of life can be, but generally speaking, there are two types of patients. One is like the acute illness patient who has some kind of diagnosis of cancer. Even if it was a cancer diagnosed 5 years ago and now they are eventually terminal, I would still consider that like an acute illness. Then there's the chronic terminal illness, where they developed a chronic life-limiting illness 10, 15 years ago, and now it's advanced enough to be on hospice. So the two different avenues can look a little different because the person coming on with the chronic illness usually can live on hospice for quite some time and sometimes even come off hospice. When you're coming onto hospice with the acute issue, some kind of cancer that's terminal, you're usually on hospice for 6 months or less. So let's talk about how they can look different. Okay, so let's talk about the chronic terminal illnesses. There are a few that I typically see, but this is just a general list. So it's usually CHF, congestive heart failure, COPD, which is a lung disease, Alzheimer's disease, or dementia if it's advanced enough, and they are different. Parkinson's disease, sometimes we'll see ALS, MS, but again, all of these diseases, these people have had for a very long time. Very long time. And now they're finally advanced enough to come onto hospice. Now, how those diseases usually look and how they decline is like a stairway. So a stairway, right? They're starting up here, then something happens. Usually it's a fall or some kind of infection and they go down. Now, once they're down here, sometimes they're bad enough to be on hospice. Sometimes they're still not bad enough to be on hospice. But what happens is they're down here and then they level out again. So now they've plateaued, they don't get better, they don't get worse. And then this can go on for months, sometimes years, and then something happens again. Again, usually a fall or some kind of infection. They go down again. Now they're down here. So now they were up here maybe 5 years ago. Now they're down here, and it was like a stairway. Maybe they come onto hospice for a little bit down here. But then on hospice, they get a little better, so they have to come off. But the decline is always plateau, something happens, they go down. Plateau, something happens, they go down. So it's this chronic illness that kind of takes a long time before you're debilitated enough to come on hospice. Now, once you're on hospice with that disease, it can be like that too. It may not be a stairway, but it's definitely going to be like an up and down. They're going to have good days and bad days, and they're going to eat some days and not eat some days. Sometimes, and a lot of times, these are the diseases that when you're on hospice, you actually get better and come off hospice. And then something happens again and you can come back on hospice. So it can be really, really hard on the person and really, really hard on the caregiver because it's a lot of work to care for someone who is 24-hour care. And most people with these diseases, once they're advanced enough, it is 24-hour care. Now, the person who is coming onto hospice with some kind of usual cancer diagnosis or something that's acutely happening. So even if it's end-stage kidney disease, now that's been a chronic illness, but once they stop dialysis, they will come onto hospice and they will die shortly after because their body is so dependent on dialysis. And you can't be on dialysis and on hospice. So even though it's a chronic illness, it's more acute and they will die quickly after coming onto hospice. Now, many cancer diagnoses, we hospice workers wish they came onto hospice sooner so they could really get the whole benefit, the 6 months benefit or more for their end of life. Now, we're still working on that. Channels like mine, channels like Hospice Nurse Penny will hopefully change the way our healthcare system works and people will start looking at hospice as not a last resort, but as a real way to live out the rest of their life. But what we typically see now is that people with acute issues, so cancers that were diagnosed, 6 months ago, a year ago, they're now advanced enough that they're coming onto hospice. Their bodies do seem to decline and change quicker than people with like chronic illnesses. So a lot of times people will be on hospice for maybe a month or a few weeks, and their decline is like a steady slope versus these plateaus. So you see a steady slope of them not eating and drinking, sleeping a lot, not eating and drinking, sleeping a lot. Both parties, the chronic and the acute, will have symptoms that we have to manage. So that is similar. I do sometimes see more symptoms in the acute cancer patient just because cancers can cause a lot of symptoms, pain, shortness of breath, things like that. But the stay on hospice is generally not as long, and the decline on hospice is more of a steady slope versus a stairway. For the families and the caregivers who are caring for their loved ones in hospice, whether they have the chronic long-term illness or the acute, we'll say cancer just to be general, decline, they're both grieving. It's both hard, but it may feel a little different. With the patients who they've been caring for, the family's been caring for their loved one for 10 years, there's a lot of exhaustion, there's a lot of guilt, there's a lot of shame, because they can have bad days where they're yelling at their loved one or frustrated or wishing they didn't have to be doing this. There's a lot of guilt and shame in that. Not that there should be, but there is, and I like to normalize it so we can talk about it. There's a lot of anticipatory grief, grieving the person that their loved one once was, grieving them before they've died because it feels like they're gone already. It's not the loved one they know. Wondering when this is going to happen. How long is this going to take? It's hard to watch their loved one go through this. On the acute side, where their loved one was kind of suddenly sick, obviously there's still a lot of grief, a lot of chaos, a lot of back and forth whiplash of are we doing enough? Do we do enough? Are we giving up too soon? And then sometimes they have more symptoms, more symptoms to manage. So shortness of breath and pain, maybe nausea and vomiting. It's hard to watch their loved one do that. So there can be a lot of emotional turmoil watching their loved one go through this. Now, the point of hospice with all of this, both ways to be on hospice, is that we provide support. We try to be the ones to help manage the symptoms, help manage the emotional stress that goes on, to help kind of level out and be a support system during this really difficult time. So please, please, please always talk to your hospice company. Advocate for yourselves. Advocate for your loved ones. Let them know how you're feeling, how they're feeling, if you're noticing changes in their condition, and if you need more help. The chronic illness versus the acute illness, neither one is worse or better than the other. They just look different, and they can look different on hospice and as they decline. And I think it's important that we know in a general way what types of patients we usually see on hospice and how we manage them. It's both hard to be with your loved one who is acutely ill or chronically ill. At the end of the day, it's still end of life. And we need to know that the hospice company is there to help us, that you can advocate for your loved one. You can talk to the hospice company about how to support you and what you may need or what your loved one may need. At the end of the day, it's about understanding what to expect with your loved one who is at the end of life and knowing where you can get help, how to advocate for yourself, and supporting each other.